Ivan said, the Work Foundation's been doing quite a bit of work on the health and well-being of the UK workforce. In fact, our work is now going a bit more international, which has been very interesting, particularly compare what governments and healthcare systems and employers are doing, particularly across Europe. We have a fairly significant programme of applied research on health and well-being at work, this Fit for Work coalition that Ivan mentioned is a 32-country study looking at musculoskeletal conditions, initially across Europe, now in Brazil, Japan, USA, Australia, New Zealand, and so on. And that's raised some really interesting questions about the growing proportion of the workforce that is going to have a long-term or chronic health condition over the next 20, 30 years. It's something that is the data's there if you look, but if you didn't know, then you could be quite surprised to hear, for example, in the UK by 2030 there'll be 21 million people in the workforce, this is just of working age, who have at least one long-term or chronic health condition. So that's something that should be a cause for concern, not just for employers, but also for government. And just in the last 18 months or so, in addition to our big project on musculoskeletal conditions, we've looked at the impact of various conditions on people's ability to play a full part in the labour market and to be productive at work. So work on multiple sclerosis, on diabetes, on inflammatory bowel disease, on psoriasis, cancer, depression, anxiety, and I'll come back to that in a second. And one of the interesting things that we found very strong in all that evidence base is that people with long-term physical health conditions are more vulnerable to psychological disorders as well. About 30% of people on average who have a long-term health condition, physical health condition, also have a comorbidity with mental health problems. And that's something which I think is often ignored, particularly by employers and GPs, actually, sometimes. And actually, you could argue that with a really clear, unambiguous scientific diagnosis of diabetes or rheumatoid arthritis, it's pretty clear what someone can do and what they can't do, how that might affect their work, how that disease might progress, and so on. But with psychological well-being, it's sometimes a bit more complicated because it's a sort of fluctuating condition, if you like, of depression, anxiety, certainly. And so what we need to do, I think, is to think a little bit more about the psychological well-being of people at work. Because it's really clear that, in the current climate, people's vulnerability to depression and anxiety is certainly enhanced, and that's something that we need to obviously watch out for. So I suppose my core question is it enough just to say, keep calm and carry on? The sort of turbulent times we're seeing in the economy and in organisations, something you just have to put up with? Or are there things that we can do in practice, and perhaps things that we can do by way of gathering more evidence about what resilience in the workplace actually is and how it helps both individuals and organisations to cope better with what looks like an even more turbulent time over the next few years?